Macular degeneration, also known as age-related macular degeneration, is a common eye disease that can lead to permanent vision loss starting over the age of 50 years old. In this video, I'll go over some of the signs and symptoms, risk factors, and treatment of this disease. If you're interested in learning more, well, stay tuned because you're watching Eye and Optometry. If you're someone who is suffering from macular degeneration or know someone who is, or an optometry student just learning about the disease, remember that the first noticeable symptom is blurry vision and or distortion. Patient will also mention that reading and night vision has also become challenging. In optometry, we use a fancy word to describe distortion that's called metamorphopsia. So usually patients won't say that or even say distortion. They'll just say that I'm seeing blurry. So it always starts off with a slight blur or a distortion, and then eventually will lead to a dark spot. When it gets dark like this in your central vision, that's usually the end stage and the photoreceptors in that area had died off. So here we have a picture of the macula and also the optic nerve. So this is the macula here, right in the center, right? That provides us with central vision. And the optic nerve, right over here, that's what connects the eyeball to the brain and also carry the blood vessels to the rest of the retinal tissue to provide nutrients. Now, with this disease, we're just talking about the macula. So within the macula, there's macular pigments called lutein and zeaxanthin. So with these pigments, they help to reduce light scatter and chromatic aberration. They also limit blue light entering your eye and try to reduce that down by absorption. Now, too much of that will be damaging to the macula, right? Because the macular pigments can only do so much. So this is why a trend of wearing blue light blocking glasses is becoming popular. That's just to prevent a lot of the blue light from going into the pigment so it doesn't absorb too much of it, right? Just to protect it for the long run. Now, if you want to know more about these blue light blocking glasses, just leave a comment in the comments section down below and I'll make a video about that more in detail. When you go to your eye doctor and they check the back of your eye, they see juiciness within the macular area. This helps trigger them that this could be macular degeneration. Juiciness are the hallmark of this disease. They are deposits of lipid and protein located between the RPE layer and Bruch's membrane of the retina. This is caused by a malfunction of the RPE. With hard juiciness, they have well-defined border, distinct border, and it varies in different sizes and shapes. Whereas here with the soft, you can tell that it has blurred margins or blurred borders. And they're more associated of having an increase of having a geographic atrophy or leading to a wet macular degeneration. Now, people who have macular degeneration tend to have the dry form, okay? 85% of the population. Now, how we grade macular degeneration is by 3 stages. So we'll have an early, intermediate, or advanced stage. Advanced stage is usually either, if it's still in the dry form, it will be geographic atrophy. If not, sometimes it can convert into the wet form, and that will be wet or exudative macular degeneration. So here we have a cross section of the retina. Zoom in microscopically, and this is what we see inside the retina. Over here, we have photoreceptors. Below it is the RPE layer, also known as retinal pigment epithelium. Below that, there's a group of blood vessels that makes up the choroid. Okay, so basically how this works is the RPE's job is to get rid of waste, break it down pretty much. As light enters and hit the photoreceptors, the outer segment of the photoreceptors sheds off. The RPE try to get rid of that, break that down, right, until like there's pretty much nothing left. But if this layer is no longer working, it cannot break it down anymore. And you have this buildup of waste material, this juiciness here. Remember I said they're buildup of lipid and protein. As this accumulates, it causes more damage to the RPE. The RPE is where you have those macular pigments, okay? The pigments is what help protect the macula through absorption. Now, if you have damage to this layer and you're losing pigment, then you no longer have protection. And as light enters and hits the back of the eye in the center within the macula, then is more prone to damage. So from the previous slide, we're just going to zoom out just a bit, and here we're left with a simplified picture of the retina. So let's go over. This is the photoreceptors, and here you have the RPE, and then underneath is the Bruch's membrane, and then followed by the group of blood vessels making up the choroid. Now this is everything how it's supposed to be when it's normal. Now if you have the early stage of the macular degeneration, you're going to have a little buildup of drusen. Now, if it's early enough, usually patients are not symptomatic. They don't notice that there's any blur or distortion in their vision. Everything looks normal, but there is something going on in the retina. And this is why it's important to get your eyes checked on a regular basis. Now, going into the end stage, if it's still in the dry form, is going to be geographic atrophy, and this is where you have a lot of that buildup of drusen and you're losing RPE. You're losing the pigment within the RPE as well, and it also damaged the photoreceptors above in that area. So basically you're just left with an opening here, and this is actually a blind spot, so you're no longer able to see anything in your central vision. You just have that dark spot, like as I mentioned earlier. And it's a bright area here because there's no longer any pigments comparison to the surrounding area. Now, if it's going into the wet stage, you have the blood vessels kind of proliferating and just going in that opening area where you have that loss of the RPE, and you have these weak blood vessels that are easy to leak out blood. So you're going to see here a lot of the blood just within the retina area there. So this is a list of risk factors that can potentially increase your chance of getting macular degeneration. So first off is age. So the older you get, the more you lose melanin. So you have less protection. And that increases your chance of getting the macular degeneration. Now, if somebody in your family has it, right, that actually increases your chance of getting it too, because you can inherit that. Increases your chance by 4 times. And especially people of fair skin, Caucasians, they tend to have less to no pigment at all, so they're at a higher chance of getting it, and it's more prevalent too within their race as well. Smoking, nicotine, the tar, all the gas coming from cigarettes, those are toxic to the macula, so that can essentially cause damage and increase your chance of getting degeneration within that area. Cardiovascular, obesity, sun exposure as well. Remember I talked about this, as the light hits that area, the pigment is actually absorbing, trying to protect it, but then accumulating all that energy or too much of it, you can essentially get a sunburn in that area and just damage, so that can lead to macular degeneration. Oh, and also too with the smoking, smoking actually increases your chance of getting a macular degeneration at 2.5 times. in comparison to non-smokers. So just want to throw that out there. And then poor nutrition. So if you don't have a healthy diet and not getting the leafy greens, the fish oil, all that, you're not actually getting the essential enzymes that are needed to properly form the pigments that can help protect the macula. So poor nutrition can lead to macular degeneration. So this is just a list of some risk factors just to keep in mind. This is just another picture of what geographic atrophy looks like. So in that area, that bright spot, you have the loss of RPE thinning and a loss of visual function. So this is in the advanced form of age-related macular degeneration, in the dry form. Now, this damage here is irreversible. So once it's done, that's it. Cannot make it better. So this is more for the optometry students. This is just here some diagnostic photos. So the picture on the left side here, this is taken with using a fundus autofluorescent. So it's pretty much a big machine that takes a picture of the retina. It's like a camera, if you will, a bright flash, and then you have this image that will reveal itself. Now, these white areas here, that's where you have the geographic atrophy. It shows as white because there's pretty much no activity going on in those areas. Remember, there is loss of visual function. The cells here are dead. Nothing is going on there. So you just have blind spots. Now, with the image on the right side here, this is done with using the same camera that takes the photo, right? But now you also have another procedure that is added on top of that, and that is with fluorescence angiography. So with that, they actually inject a yellow dye, usually it's within your arm, into your veins, goes into the bloodstreams, and then that just flows up within to the retinal vessels, and the retinal vessels you'll see will be filled with the fluorescein dye. That's why the blood vessels here are black and in comparison to it being white in the other picture, and then it will fill up these areas here. So all the geography atrophy areas are black because they're filled with the fluorescein dye, filled with fluid. So even if you have like blood spots too, it will also show up as black as well. So we're just showing the difference by taking different diagnostic procedures and pictures, how it will present itself. So here is showing what wet ARMD will look like. So starting here at the beginning, so before you have any dysfunction, this is normal and you don't see any drusen's, everything looks good, everything's intact. Now here you have a buildup of the drusen's, right? This is the early stage, and you have more of that drusen's. Now you have a break here in the Bruch's membrane, also in the RPE, and the blood vessels can actually proliferate and you have neovascularization essentially. Now, with these new blood vessels, they're not strong. They're very prone to breakage. So it is easily for them to leak out blood, and this is what you're going to see here. So coming out of these leaky blood vessels, it's not always just blood. Sometimes you just have additional fluid, and this fluid is called choroidal neovascular membrane. Now, you get this when there is a break in the Bruch's membrane. So let's go back here. So this is the Bruch's membrane. So anytime there's a break or opening, that's where fluid can essentially leak out from these blood vessels and go into the retina, basically. Now, if it's underneath the RPE and between the Bruch's membrane, so underneath the RPE and above the Bruch's membrane, that's just called a sub-RPE type of CNVM, choroidal neovascular membrane, and because it's underneath the RPE layer, you have the pigment on top, so when the eye doctor's looking from above, it comes out to look like a grayish green area. That's just accumulation of fluid from the leaky blood vessels. Now, sometimes it can even go further into the retina and above the RPE. So it's actually below like the photoreceptors layer and above the RPE cells. And that fluid will look more reddish than the greenish gray appearance. So another type of sign to see in the macula when it comes to wet ARMD is pigment epithelial detachment, or PED. Now this is detachment of the RPE from the Bruch's membrane. So you're always going to have an elevation always underneath the RPE layer. So in this type here, there's different types actually of PEDs, but this one here is called Juicinoid. So you also have, you see the dots there, those are the drucins. You have the drucins and then the PED. So you just have that like dome shape elevation and is always underneath the RPE layer. Here you have a more hemorrhage type of PED, and you can see there's blood there. So again, just make it easier for you. Think of that that neon yellow line area. That is the RPE layer, and you have the elevation. So you just have that buildup of fluid there, and it's called detachment because it's not supposed to be, the RPE layer is not supposed to be on top. It's supposed to be pretty much flush with the bottom lining of the retina here, right, along with the Bruch's membrane. It's because you have that elevation, you have that detachment, that's the PEDs again here as well. This here is more serous type, so it's just fluid, no drucins, no blood, is just clear fluid. And here you see is that dome shape underneath the RPE, and you can see a demarcation line where you have that fluid area there. This one here, this is not a PED because you don't have that elevation underneath the RPE layer. It's actually more into the retina, so this would be more of a subretinal fluid along with some cystics or edema area there. Here is a fibrovascular PED. So you kind of see like a fibrovascular layer, or more like think of it like a scarring type of layer there over the macula, and you can see it more here when it's black and white. Again, it will just look more like the typical PED, nothing fancy, but you just have more of a vascular layer just on top of the macula, so it's just another type of PED. So those are usually just the four types: the fibrovascular, serous, hemorrhage, and the drucinoid. Now, if a patient comes in and they have early macular degeneration, but no symptoms, vision is clear, no problems, the eye doctor will still want it to monitor this patient if there's any changes, because remember, this is a progressive disease. So usually the eye doctor will give the patient a home screening test to take home, and this is called the Amsler grid. So basically the patient would just have to focus at the black dot in the center here, right, because we're checking for central vision. So always focus at that center dot, the black dot, and if there is any changes in the surrounding lines, like any waviness or distortion, gaps, or anything that's out of the norm, right, because it's supposed to be straight lines, then that's how you know that there is something going on, right? There is changes. So usually a patient with ARMD will have the wavy lines or distortion there, and this is basically what we call the metamorphopsia. Now, there are different types of treatments depending on the severity and the type of ARMD a patient has. If it's still in the dry form, the eye doctor will usually just tell the patient to take some eye vitamins or supplements, and that will help to slow down the progression for not getting worse into the advanced form or into the wet form. It is known that the eye vitamins actually slow down the progression by 25%. So it's pretty good. And if it is already in the wet form, so you have these two treatments here. So starting with the anti-VEGF injection, so it's actually a needle that the specialist will do, inject this type of medication inside the eye that will help to stop the abnormal development of the weak blood vessels and to get rid of the bleeding. And this is something that is not just a one-time treatment. You have to keep getting these injections to kind of just manage the severity of this disease, and this is usually taken on average every 3 months. Another type of treatment is with the photodynamic therapy. So that's a combination of medication and a laser to kind of seal off the blood vessels. So this is usually more of an older type of treatment. Is not really commonly being done nowadays. Mostly is with the anti-VEGF injection. So that is pretty much the treatment. There's no cure per se. When you have this wet AMRD, you pretty much have to keep getting these injections just to manage it off. And there's also other laser options, but again, if it's not managed, then you just have to keep doing this. So looking into more of the eye vitamins, scientists have done the research and provided a formula, and they call this AREDS2. So AREDS2 is just a study that provides the formula for what is good for prevention or to slow the progression of macular degeneration. So they come up with vitamin C, vitamin E, the lutein, zeaxanthin, so remember those are the macular pigments, zinc, and copper. Now, they ruled out beta carotene and omega-3 fatty acids because those were in the AREDS1 formula, then the old formula. And they actually found out that taking out those two is not really it's not really helping much. It's not really providing much benefit, so it's not really needed. So they took it out and they have the AREDS2 now. The beta-2 carotene is also known to increase your chance of getting lung cancer, especially in smokers, people who smoke. So if you are a smoker, then best to get the AREDS2 formula so you don't have that risk factor of getting lung cancer because of the beta carotene. So AREDS2 I would just recommend for anyone really. And the different brands, there's Vision, there's iCaps and Ocuvite. There's so many different brands out there that will have the AREDS2. So can't really tell you what's best. They pretty much all do the same. So it's just your call, and it just based off on prices, I guess.